Yeah. I know we can make it. It's only just a phase. Once we're vaccinated, and everybody gon' be safe. Everybody gon' be safe. One kind, yeah. One people. We are roll up to roll up, yeah. Cause no man's alone, do what's right, cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you, I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. Yeah, yeah, it's better for us. Tell your mommy to let it roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
A pleasant good evening to residents, nationals, and citizens around the Federation and in the diaspora. Welcome to Leadership Matters, a program which is hosted by the Prime Minister of St. Kitts and Nevis, Dr. the Honorable Timothy Harris. He uses this program to keep you updated on important events and updates taking place right here in the Federation. Every show, which is aired usually weekly, he is joined by special guests, persons who work in the civil service or the private sector who play a critical role in the development of the country. This evening, he has a special program for you, and his special guests this evening are the Minister of Health, the Honorable Akila Byron Nisbet, the Chief Medical Officer in the Ministry of Health, Dr. Hazel Laws, and the Medical Chief of Staff at the JNF General Hospital, Dr. Cameron Wilkinson. This evening, for opening presentations, we have a slight change, and we will not be hearing from the Prime Minister first, who usually would make opening remarks at the start of the show. Instead, we will first hear from the Chief Medical Officer in the Ministry of Health, Dr. Hazel Laws. Dr. Laws?
Thank you, Jacqueline, and a pleasant good evening to everyone. The COVID-19 pandemic has upended the lives of the people of the Federation. We are experiencing an outbreak of COVID-19, and we are trying our best to to contain the second wave of COVID-19 cases. This is a war, and we need all hands on deck. This second wave started on May 19, 2021. Last evening, we recorded 19 additional cases of COVID-19. And today, we received positive results for an additional 6 cases. These 25 cases bring the total of COVID-19 confirmed cases to 119, with 105 cases for St. Kitts and 14 cases for Nevis. We have registered 53 cases. We have registered 53 recoveries so far and 4 hospitalizations. Ladies and gentlemen, all 4 patients are stable. There are no COVID-19 related deaths. I repeat, there are no COVID-19 related deaths. There are now 66 active cases, so the Ministry of Health is monitoring 66 active cases. The most recent cases include 1 imported case from the Dominican Republic and 1 case from the Tyrrell Williams Primary School, which is now cleared from an outbreak at this time. 1 case in particular is also responsible for transmitting the virus to 9 contacts. Such a case is referred to as a super spreader. A significant number of the recent cases are involved in the gaming sector. Approximately 7 entities have been impacted through the contact tracing process. Approximately 1,460 individuals have been engaged by the Ministry of Health through the contact tracing process. 870 of these individuals have been received from self-quarantine, and a remaining 590 are to be tested and discharged. What are some of the successes and positives? So far, we have prevented the spread of the virus in our schools. So 6 schools have been impacted so far, and they have all been cleared from an outbreak. Secondly, the contact tracing process is working. We have identified cases, we've reached a number of contacts, and prevented a significant number of cases already. Our robust contact tracing process is preventing an exponential expansion of this problem. So this is another positive. At present, the positivity rate is still acceptably low. It stands at 1.6% approximately. There are no COVID-19 related deaths so far. This reflects the state of readiness of our health system. The Ministry of Health has updated its clinical guidelines that provides the roadmap for care delivery to persons impacted by COVID-19. Our national vaccination program is successful, with 64.3% of the target population covered by the first dose and 27.1% of the target population fully vaccinated. So what are some of the factors driving this outbreak? Now, based on the information or data gleaned through contact tracing, we realize that the private and the public sector entities and individuals, they are not adhering to the COVID-19 prevention and control measures of, for example, the wearing of the face mask, hand sanitization, and evaluating employees upon arrival at work at the beginning of the workday. What we found is that a number of employees are showing up and are coming to work while experiencing flu-like and COVID-like symptoms. Another factor, the vaccination rate still remains below the herd immunity threshold. So what are we doing? What are we doing in terms of the Ministry of Health? What's the way forward? The Ministry of Health is strengthening the contact tracing process by increasing the cadre of staff or personnel who will be engaging the contacts of the cases. We are increasing our testing capacity, so one mobile unit will be added to the fleet. We are also increasing the number of case managers who will be supported by the A&E physicians. We are establishing a COVID-19 isolation site, and we hope to launch the SKN mobile app that's going to help us to monitor the cases and contacts. We need to engage the key stakeholders to help public and private entities improve and adhere to the COVID-19 prevention and control measures. We must press on with our national COVID-19 vaccination program. Ladies and gentlemen, this summarizes the current COVID-19 situation. In closing, I would like to underscore the importance of the COVID-19 prevention and control measures and the importance of accepting the vaccine in this fight against the pandemic. Thank you.
Thank you so much, Dr. Laws. We'll now hear from the Medical Chief of Staff at the JNF General Hospital, Dr. Cameron Wilkinson. Dr. Wilkinson?
We have been in a fight against this deadly virus for over a year now, and we will save the ravages of it with the measures we have put in place. As we enter this leg of the fight, with us being in community spread, some have asked some tough questions. What is a lockdown? When is it indicated? It was used before. Can it be used again to contain the spread? So what is a lockdown? The lockdown is an important tool held in the hands of the epidemiologists. It's like the trump card or ace kept in reserve but brought into play strategically as a game changer to stop the viral spread. It's a circuit breaker which, when activated, brings the virus movement to a halt and breaks the transmission chain. Ultimately, this circuit breaker can stem the transmission of COVID-19 and disrupt the infection peaks. But remember, the virus only moves with our help. The lockdown is therefore used to restrict mass movement and gatherings to stop the spread of infection and ensure the capacity of the virus to move from person to person is limited. We can voluntarily wear a mask, social distance, hand sanitize, and get vaccinated to prevent the movement of the virus, or government can impose curfews and lockdowns to stop its movement. What is the science behind the lockdown? The lockdown is aimed to reduce the reproduction rate or R number of the virus, or to reduce the number of persons each confirmed case can infect. The larger goal of any government is to keep the R number below 1. That is, each confirmed case infects fewer than one person. If the R number is below 1, say 0.5, then 100 persons may infect 50 who may infect 25, and this will continue to decrease until the virus disappears. On the other hand, if the R number is 2, then 100 persons may infect 200 who may infect 4, leading to a significant increase in the number of cases and eventually an overwhelming of the healthcare system. So what's the public health decision re-lockdown? The evidence is clear that this circuit breaker or lockdown is an effective tool that can suppress the COVID-19 pandemic. So why is it not being used every time there is an outbreak in every country? Because there is a delicate balance to be considered, a tightrope to walk in making such decisions. From the strict standpoint of controlling viral transmission, 1, a 14-day lockdown will break the virus transmission cycle and the cases will fall, because if people do not move, the virus will not move and the R number will fall below 1. 2, it gives contact tracers and the healthcare system time to catch up, provided the restrictions are enforced and people follow the rules. And 3, these circuit breakers also affect the size and timing of the infection peak. The lockdowns can push the peak of subsequent waves of infection into the future, like 2-3 months down the line. These public health decisions, re-lockdowns, cannot be made in a vacuum, however. They have to be embedded in a broader policy that considers the social, psychological, and economic impact on citizens and residents. Other parameters that are considered include the population demographics, population density, the weather, and the infrastructure of the healthcare system. There is no one-size-fits-all approach to the use of the lockdown. Because it was successfully used in country A doesn't mean it should be used immediately in country B. Some consider a nationwide lockdown as a nuclear option used as the final resort, as it could have adverse effects on every walk of life and every sector of society. So the question is, where are we now? The lockdown was a necessity in 2020, mainly because the virus was new and we had little defense against it. We now know more of what we can do to control the spread before pulling the circuit breaker, but it always remains an option and can be pulled at a moment's notice if the situation changes. Our positivity rate, as you heard, is very low, 1.56%, which is below the threshold of concern, which is 5%. Our death rate is 0. We have had a few super spreaders, but the R value, or the number of persons each person infects, is low, below 1. Our healthcare system remains robust and it is not overwhelmed, as we have 4 admissions who are stable. Our current high vaccination rate offers significant protection against significant disease, death, and hospitalization. We need to learn to live with COVID. This does not mean 0 COVID cases, but decreasing our risk of exposure and increasing our protection against severe disease and death through vaccination. All the gains we have made can change overnight if we do not remain vigilant. Unfortunately, for quite some time, it was business as usual for many, with no strict compliance to COVID-19 appropriate behavior. Many failed to follow the prescription of non-pharmaceuticals and failed to take the opportunity to get vaccinated under the false belief that if we had no positive cases, then there was no reason to act. We said that community spread was inevitable and we needed to prepare for this occurrence. We are now in community spread and most likely on the upstroke of the wave of the current infection. We may therefore see more positive cases over the next few days as we continue our contact tracing exercise until we plateau and come back on the other side of normal. Since the outbreak of community transmission on May 19th, we have had 8 recoveries from the number of cases we've had. The CMO just said we have 66 active cases and 4 are hospitalized and stable, and we have had 0 deaths. Most of the cases identified were through contact tracing, and several were linked to a common source. Most were either not vaccinated or only recently received 1 shot. Those persons who had some degree of protection have little or no symptoms. What is the general way forward? Faced with the current crisis, we have to strike the delicate balance between limiting infection spread, protecting the health services, and maintaining the economy. The emerging evidence is that the AstraZeneca vaccine is 63 to 83% effective in decreasing viral transmission. It decreases the risk of severe disease and death significantly. We can stop the spread of the virus by getting more persons vaccinated. We can stop the spread by strict adherence to wearing a mask and social distancing. We can do these things voluntarily or be forced into a lockdown if we allow the situation to get out of control. Everyone across the Federation needs to follow COVID-19 appropriate behavior. If everyone follows the COVID-19 appropriate behavior, then it will be easy to curb the spread of the virus. This needs to be enforced at all levels, the individual, community, businesses, and government. The epidemiological triad has three factors, if not properly managed, can drive a disease number up. And these are the agent, the host, and the environment. The agent is the virus, which is relentless in its attack, and our attack and defense must also be relentless and sustained. There is no room for complacency. The host, that is you and I, we keep saying that the virus cannot move without our help. We all can be practicing COVID-19 precautions and getting vaccinated to prevent the spread. And the environment is everything happening around us. The individual, the private and the public sector need a tighter control on this in terms of mass gatherings, public transportation, and places of business to create an environment that does not encourage the viral spread. To date, you heard, we have 21,125 individuals who received their first jab. These are persons over the age of 18, bringing that total to 64.3% of our target population. And also 8,959 adults, or 27.1% of the population, the target population, they are fully vaccinated. These figures speak to the protection that exists in the community this year that we did not have last year. We need to continue to push to get more persons vaccinated and remind persons that while the vaccine is free and an individual choice, curfews and lockdowns imposed are mandatory and come at great cost to the individual and all. I want to end by reassuring again the unvaccinated, as I did a couple of days ago. Our fight has never been against the unvaccinated. We have been fighting for the unvaccinated since the start. We have been fighting for our school children, all who are unvaccinated. We have been fighting for the pregnant mothers with their unborn children, who are all unvaccinated. We have been fighting for the elderly and frail, many of whom are unvaccinated. We have been fighting for the 30% of the population below the age of 18 who are all unvaccinated. The fight to reach herd immunity is a fight to protect the unvaccinated in our community. What we are fighting for is to have a significant proportion of the population vaccinated to protect those who cannot be vaccinated. Everyone, as I said before, deserves a fighting chance and a lifetime. Those who cannot be vaccinated can be given this fighting chance and the opportunity of a lifetime by you who can be vaccinated going forward and getting vaccinated to protect them. Don't wait until you test positive or your business is about to close because of viral exposure to ask to be vaccinated. Go out tomorrow and get your first shot. Go out tomorrow and get your second shot to be fully vaccinated so that we can get back to some sense of normalcy. I thank you.
Thank you so much, Dr. Wilkinson. We'll now hear from Minister of Health, the Honorable Akila Byron Nisbet.
Thank you very much, Jackie. And a pleasant good night to everyone viewing and listening to this edition of Leadership Matters. It was just yesterday that I would have spoken to you about the fact that it has been more than a year now since the start of the pandemic that we have been coming to you to keep you informed and updated throughout. We have been giving you the facts to allow you to make informed decisions as it relates to your individual response to COVID-19. Tonight, we are here again at Leadership Matters, as have been the case before, to give you the necessary information, update you, and engage you so that you are able to get the information and get the clarity required to continue to make informed decisions. As it relates to our vaccination program, as of end of day today, 8th June, I am happy to update you, as have been before, that 21,125 adults over the age of 18 have been vaccinated. This represents, as you've heard, 64.3% of our target population. I am also happy to report that 8,959 adults are fully vaccinated. As you can see, our vaccination numbers continue to climb daily, and I want to encourage persons to continue rolling up their sleeves to be vaccinated, and please remember to return to the clinics for your second dose. This information tells us that our comprehensive vaccine education program have been bringing the majority of the country on board, as proof by the increasing vaccine coverage. These education sessions will continue so that all who can take the vaccine will voluntarily come forward and be immunized, having all the information that they need. Remember, this is not just to protect yourself, but all who are depending on you for protection. The evidence has shown that the vaccines work, and right now, it is the main tool we have in the fight to get us back to some sense of normalcy. Our high vaccine coverage will give us the protection needed to prevent an overwhelming of our healthcare system. We have been fortunate in St. Kitts and Nevis in that we were able to have a very high vaccination coverage before going into community transmission. The science tells us that this high vaccination coverage will protect us. At the Ministry of Health, we have been preparing for over a year now for this eventuality. As such, we have been making the necessary improvements and investments to strengthen our health system. Over the past year, we have strengthened our public health policies to ensure that we are able to deal with the current pandemic and any future pandemics. We also have been making the financial investments to ensure that we have an adequate supply of ventilators, oxygen concentrators, and PPEs. We have made the required investment in our laboratory, and that investment gives us the capabilities and the capacity to perform COVID-19 testing at our lab at GNF. We have also ensured that the lab is equipped with adequate supplies of testing reagents and testing kits for COVID-19. The aim is to ensure that our health system remains strong, and we cannot do anything that would undermine the efforts done to strengthen our health system. We are also proud in the Ministry of Health of the work that have been ongoing within the ministry relative to our response to the current community transmission. As you have heard already tonight, our robust contact tracing and testing program continues to identify any positive cases, and those cases have been isolated. And any significant contacts of these positive cases have been quarantined to contain the spread and to bring the community clusters to an end. To date, as you have heard, we have a total of 119 confirmed cases, with 53 fully recovered. Since the community outbreak on May 19, there have been a total of 74 cases. The identifying and isolation of these positive cases is testament to the success of our contact tracing program. Left undetected, they would lead to widespread viral transmission across the Federation. You've heard much about our positivity rate, and we are happy that our positivity rate remains below the 5% threshold, and this continues to be good news for us. At the height of the outbreak of the pandemic in the United States, some states like Mississippi, Nevada, and Florida had percent positive levels higher than 15%, far above that 5% requirement. Through vaccination, along with the use of non-pharmaceuticals, they were able to halt the spread of the virus and bring things under control. I reiterate again, this is how we will be able to live with COVID-19, through vaccination and through us following our non-pharmaceutical measures of face mask, social distancing, and continuing to keep our hands clean through washing with soap and hand sanitizing. The Ministry of Health will continue to expand our web of testing so that all with a potential exposure are tested, thus ensuring that the virus can be contained. As you've heard, we've complemented our testing team to ensure that we have the adequate number of testers and capabilities to be able to test the persons needed to be tested and to continue to bring it under control. We will also be continuing engaging in targeted testing. Yesterday, I would have reported on the position relative to the implicated schools. Today, I am happy to report that all 6 schools implicated have been given the all clear. Just as a reminder, these schools are the Sandy Point Primary, the Charles E. Mills Secondary, the Seventh-day Adventist Primary, the Washington Archibald High, the Bastia High School, and now the Tyrrell Williams Primary School. As stated yesterday, there are a number of business places that have been associated with the recent outbreak. For the safety and protection of the general public, 6 businesses were temporarily closed while we continue our contact tracing and testing. Now, while the decision to get vaccinated is a voluntary decision, the consequences of not being vaccinated and exposure affects all of us. Important to note as well is that the majority of recently infected persons were either not vaccinated or had only received 1 shot. I can't reiterate more. The vaccine is our best defense against COVID-19. It significantly decreases your risk of getting infected. It significantly decreases your risk of getting seriously ill and hospitalized. And it can prevent you from dying from COVID-19. This, in conjunction with the non-pharmaceutical measures of social distancing, hand sanitizing, and wearing your face mask, is what will protect you. So we want you to do your part to ensure that the gains we have been making in strengthening our health system would not be undermined. Your individual actions of following the non-pharmaceutical measures and vaccinations help us to maintain the gains we have made to strengthen our health system. And again, I just want to end by reminding you that the vaccine is our best shot at getting back to normalcy. So get vaccinated. Please go out and get your first dose. And if you've already had that first dose, please return to the clinic for your second dose to be fully vaccinated and protected as we continue to march towards herd immunity. Thank you.
Thank you so much, Minister. And now we're going to hear from the person who is responsible for bringing you this very important program, Prime Minister, Dr. the Honorable Timothy Harris. Mr. Prime Minister.
Thank you, Jackie, for again moderating tonight's program. My fellow citizens and residents, I want to thank you for joining us tonight in this very important and informative edition of Leadership Matters. Tonight we continue to update you on our ongoing fight against COVID-19 and the measures we are taking to continue to protect you and your loved ones. The virus continues its negative impact on the lives and livelihoods of many in our global community. Specifically as it relates to St. Kitts and Nevis, you have heard from speakers before me of the efforts of our Ministry of Health in particular to contain and defeat the COVID-19. Part of our very good news story is that 64% of our population has received their first dose of the vaccine. This represents the highest proportion of the population in our Eastern Caribbean Currency Union. And we are testing more people than many other countries in the Currency Union. This takes us closer to our threshold or target population achieving herd immunity. The closer we get to that target, we would have collectively as a people enhanced our own protection against COVID-19 and place ourselves and our country in a stronger position to return to normalcy. The figures show that the majority of people in St. Kitts and Nevis are rising to the challenge, and I want to congratulate and thank them. The people of St. Kitts and Nevis cannot afford to become complacent in the fight to contain the virus and restore our country to the path of growth to which we had been accustomed long before COVID-19. The figures that you have heard tonight also strengthen the resolve of our Team Unity government to continue protecting our health and that of your family and loved ones. Our approach to COVID-19 from day one has always been guided by science and the advice of our health experts. It has also been in accordance with the World Health Organization guidelines. The World Health Organization, you would recall, is the premier authority on matters of global public health. In light of the current situation, we continue to strengthen our COVID-19 response. I want tonight to announce some additional restrictions that we have determined are necessary in the continuing fight to defeat COVID-19. And in doing so, I want to reinforce the point that has been made by each presenter tonight, that the ultimate and most effective weapon we have in our arsenal to defeat COVID-19 is the vaccination program. We must make an outstanding success. The vaccination program, along with the observance of the COVID-19 protocols, will take us to where we need to go. The land in which each and everyone can feel safe and be assured that everything is being done by everyone to keep each other well. We want to encourage persons to work from home as far as possible. That is, those workers who have, and institutions which have the capacity to, should be allowed to work from home. This, of course, will reduce the numbers at the workplace at this crucial period of time. To the extent persons can, we want to encourage them to engage in online shopping over the next 2 to 4 weeks. The benefit of this is that we will avoid overcrowding in our supermarkets and other commercial spaces, and therefore help to contain the spread of the deadly virus. We encourage essential movements only, and these include grocery shopping, going to seek medical care, pharmacy, going to the bank, and of course going to work in those cases where the stay-at-home option is not applicable. We discourage non-essential movement like partying and liming on the strip and any other mass events. Indeed, we had previously indicated that all mass events are prohibited. The churches and bars should adjust to ensure that their operations are in keeping with the COVID-19 Prevention and Control Act 2020. The government takes its role in protecting its citizens and residents seriously. And we will assure you that stronger measures will be taken if and when necessary as the situation warrants to protect your health and that of your loved ones. I urge all of us to follow all, I repeat, all of the COVID-19 protocols, and most importantly, to vaccinate at the earliest convenient opportunity. We are confident that with your help, we can defeat COVID-19. You too can be confident that unlike in many parts of the world, our testing regime is working. Our track and trace processes are working, and our health system clearly is working well up to this point. We must be very careful not to undermine our health system with consequential loss of life. As a community, we can all do more than just rely on these measures to keep us safe. We can do so much more. We can all ensure that we are immunized. Already 64.3% of our population have heard the call, and they have chosen to be immunized to protect themselves and, more importantly, their loved ones. Vaccination was and still is our best defense against further COVID-19 outbreaks. We all want to defeat COVID-19 in St. Kitts and Nevis, but to do this, we should all vaccinate. We all want to keep our schools open and our children safe within our educational settings. To do this, we as adults should ensure we are vaccinated. Yes, I am sure all of us want to attract the tourists back to our federation. To do this, we must all vaccinate. To help get our economy back to full strength and put more people back to their jobs, we must all vaccinate. I know, of course, that for some persons, getting the vaccine was not an easy decision. Some of you had concerns. You did your research. You looked at the information provided, and you did the right thing. You got yourself vaccinated. You and all of us are indeed better for it. So I want to say thank you for making that choice to protect yourself. Thank you for making that choice to protect your loved ones. And thank you for making that choice to protect your community. If you have not yet had your vaccination, I strongly urge you to do so tomorrow. Indeed, across all 17 health centers, an opportunity is provided to get vaccinated. The events of the past week show, while we all need to play our active part in the fight against COVID-19, the consequences for our families and loved ones are serious. Some businesses had to close when their workers were affected by COVID-19. The continuity of business can be undermined. The livelihoods of their employees and the ability to take care of their families are put at risk whenever we have the upsurge in COVID-19. This is a fight we all must join. For COVID-19 does not discriminate. It doesn't consider politics. It certainly doesn't consider color or class or any other socioeconomic indicator. It does not give us a choice. It will attack us and it will kill us where we have laid down our guard. The only choice we have in this matter really is to be vaccinated. I want to underscore the point made by our medical chief of staff, our CMO, chief medical officer, Dr. Hazel Laws. We are in a real war. We have to take this situation very serious. And in war, we have to fight back. We have to fight back with all that we have, every tool. My government will not take any of the tools available to defeat the COVID-19 off the table. All tools remain available to win this war. This is an existential threat, and it is a war in which we are engaged to win. This war requires all of us to focus on the defeat of the COVID-19 and what each of us can and must do to obtain the victory. If we really want to defeat the virus, it is very simple. get vaccinated, be immunized. The most powerful tool which we have in this fight is the vaccination program. I want to encourage everyone, every citizen, every resident, regardless of your immigration status, to join the fight against COVID-19. Put St. Kitts and Nevis above yourself. In that regard, I want to end on a note of commendation to the members of the panel who are here with me tonight, and to thank each and every one of them and the wider team within the Ministry of Health and the task force for the excellent work that has been done to keep St. Kitts and Nevis safe and secure, and to ensure, as we listen to the news elsewhere, we are reminded of the fantastic job that has been done to date. We cannot sit in our laurels. We have to keep on doing well. It is sometimes very easy to take a wrong decision. The difficulty sometimes is in getting it right. We want everyone in St. Kitts and Nevis to get it right in this fight against COVID-19. And to get it right, you have to be, and you are encouraged to be vaccinated. I thank the Honorable Akila Byron Nisbet, our Minister of Health, for her leadership of the health programs, and in particular for the contribution that she has been making in this fight against COVID-19. I want to thank Dr. Hazel Laws, our Chief Medical Officer, for her yeoman service in this regard, and for which we have appropriately honored her, as we have done to Dr. Cameron Wilkerson, the Medical Chief of Staff at the Dreneff Hospital. This has been a most challenging time for our country. Indeed, there are no earlier referent to which we could point to for guidance. In this battle in which we are engaged, it has to be an all-of-society approach. And in that regard, I want to thank all those who have been constructive in their approach. I want to thank all those who stood firmly on the right side of this battle. The right side is to abide by the COVID-19 protocols, and the right side is to become vaccinated, so you take the country to the stronger and safer future which the people of St. Kitts and Nevis deserve. Thank you very much.
And thank you, Mr. Prime Minister. We're going to take a quick break now, but I know that given the critical updates you have just received, you probably have a lot of questions, concerns, and maybe even suggestions. And when we return, you'll get an opportunity to put all of those to our panelists, who I'm sure will try their best to respond to as many as possible. I'm told that our viewership is very, very high tonight, and of course, we're going to try our best to accommodate as many as possible. Allow me to share the numbers with you now so that you can prepare to call once we return. The numbers you can dial to participate in the program are 466-2666, 662-8674, 767-4765, and there's an international line, and the number for that is 1-239-645-4500. Those numbers are listed at the bottom of your screen for your convenience. We also have 2 WhatsApp numbers via which we receive messages and voice notes. And if you want to use that option, you can send your WhatsApp messages or voice notes to 661-5683, that's 661-5683, or 660-7168, that's 660-7168. So we're going to take a quick break now. Don't touch that dial, and we'll return shortly.
Me no know about you, but me don't think it's bad.
Be St. Kitts strong and mask up.
And I wear my mask to protect my beloved citizens and residents of St. Kitts and Nevis. I invite you to do so too.
Show your love for St. Kitts Nevis and wear a mask.
Keep St. Kitts strong and mask up when you step out.
I wear a face mask for all the nurses, doctors, and other medical workers who are on the front line.
Do the right thing and wear a mask.
Show the world that we are St. Kitts strong and wear a mask.
I wear a mask so that St. Kitts Nevis remains a safe and healthy destination for me, for you, and all visitors alike.
St. Kitts sweet. Me no know about you, but me love St. Kitts bad.
You know, it's me, Mr. HE, and I'm here with one message. Roll up to roll out. We all know how difficult things have been during this COVID-19 pandemic. While we continue to wash our hands, wear a face mask, and practice social distancing, how about we take it one step further and get vaccinated? Call the nearest health center to find out if you are eligible to be vaccinated. Or you can contact the Ministry of Health at any one of these numbers down below. Don't be discouraged by the negativity. We all have a role to play in protecting this federation. So, St. Kitts and Nevis, let's roll up to roll out.
Welcome back to Leadership Matters, which is hosted weekly by the Prime Minister of St. Kitts and Nevis, Dr. the Honorable Timothy Harris. This evening, he's joined by the Minister of Health, the Honorable Akila Byron Nisbet, the Chief Medical Officer in the Ministry of Health, Dr. Hazel Laws, and the Medical Chief of Staff at the JNF General Hospital, Dr. Cameron Wilkinson. My name is Jacqueline Bryan. I'm your host this evening, and the conversation is about ensuring safety during this COVID-19 pandemic. We've had critical updates at the beginning of the program with presentations being done by the Prime Minister and his guests, and this is the point of the program where we hear from you, our viewers and listeners. So we're going to go now to the phone lines. I'm going to ask that you keep it brief, and of course, to be kind, remember other callers who are trying to get in to the program so we can take as many persons as possible. Welcome to Leadership Matters. You're live.
Good night, and leadership really matters. I was a bit scared because I didn't know if any show would be tonight, seeing that we're on the curfew. But nonetheless, we do have good leadership in this country by Dr. Timothy Harris. This is Bucky got it. Now, first, let me say, you all, the government is doing a good job. Now, we don't have any debt, and that's wonderful, right? And it appears that the government is so calm during this time dealing with the COVID-19 cases. I don't know why you're also calm. And people are panicking, but the government is so focused, right, that they have things under control, right? Now, Mr. Prime Minister, persons making noise say, lock down the country. But I'm happy that you have made the decision not to lock down the country, because people need some kind of movement. We are very stressed, and you continue to show good leadership. You continue to take your time in fighting this COVID-19. So thank you for not lockdown. At least we have a little curfew. We can go to work. We can go to the supermarket. We can get things. So thank you for that. Good judgment there. Now, let me just turn a little bit. In terms of severance pay, could we get an update? Because people keep asking me about, if they're still going to get their severance pay, how fast it is. So could you give me a little update on the severance pay, how it is going, if persons are coming forth with the information that is required? I know you spoke about it more than once, but it's a topic during this time of COVID-19 where finance is very important, right? Now, what is the perks? What can we benefit from reaching herd immunity? Because we are 64.5%. We're almost at 70. So what can the country benefit? I know there's a football game tonight. Persons who are fully vaccinated still cannot go, right? The person is a bit skeptical, like, hey, well, if I fully vaccinate and I don't have any benefit, what is this sense? right? So could you give me some update on that? I'll be very short because leadership really matters and you continue to show leadership. And this is Bucky Garrett, over now.
Thank you so much for your brevity. And of course, if time allows, you can always try to call back. We'll take another call. Welcome to Leadership Matters. Thank you. Welcome to Leadership Matters. We'll take another call. Welcome to Leadership Matters. Okay, we'll have a situation with the phone line, so hopefully we'll have that cleared up soon. Do we have a call?
Yes, hello. Good night.
Hi, good evening.
Yes, good evening to the panelists, and I want to say good evening to the Minister of Health, Akila Nisbet, to see you on the panel. There's a few questions I want to ask very quickly. One, Akila, Ms. Nisbet, what happened? The nurses is asking about the overtime. They're saying that since in February, there's no overtime and they have to work double shifts. You know, they're short staff of nurses. So they were wanting about the double and the overtime. The second question I'm asking to you, how many ventilators is there at the J.M. France Hospital based on what we are seeing about this vast spread of the COVID? How many ventilators was there before 2020 and how much ventilators we have now? And do we have any ventilators for children? Because we realize kids now is getting this COVID. Do we have kids ventilators? The other point I want to ask you, what happened to outpatient? Why is it we have outpatient split in two, where we have one half of outpatient where you have COVID patients, that those who are coming with COVID, they go on one half. And the other half is where that if you're feeling sick, you're going and see the doctor. And then you have private ward where you also have COVID patients. Do you think it's a good thing to be using the hospital where you have COVID patients and still having other different patients and the same ward? And do you have the nurses them who dealt with those COVID patients working on a different ward, like medical ward, surgical ward? Because I am hearing the nurses them is for short staff, so sometimes when they finish dealing with the COVID patients, they have to also fill in on other wards. And the nurses them is asking, why is it that they will get tested every week or every other 2 days when they are finished with the COVID patient, when they are going home to the family? So there's questioning why that they don't get tested and they have to go home to the family and are also dealing with the COVID patient. I will listen off here. You guys have a pleasant night.
Thank you so much for your participation in the program. We'll take another call. Welcome to Leadership Matters.
Hello.
Hi,
good
evening.
Night.
Good night.
I am directing this question to the Prime Minister. I think he's too lenient. He is someone that has deep feeling for others. And so what I am saying is that he needs to be more firm with these people, because I went and I took my first dose. And it's not time for me to take my second one, but I'm going to take my second one tomorrow, because I prefer to die from the injection than to die from COVID. So therefore, I am going to take my shot tomorrow. Prime Minister, I feel it for you.
Okay, I think we lost that caller. Unfortunately, you got cut off before you were able to finish, but please try calling back. We'd love to hear the remainder of what you had to say. We'll take another call at this time. Welcome to Leadership Matters. Hello, good evening. Welcome to Leadership Matters. You're live.
I'm on?
Yes, you are.
Okay, good night, everybody. Ms. Brian, good as usual. My wonderful Prime Minister, I will always say none like you. just want to wish you God's blessing, protection, strength, good health, safety on the Federation as we in the hurricane season. It will be you again. And on your anniversary, and the others must thank God for you. We was the last. I hope they hear what's going on. Vaccinate. At your conference, you speak about the amount of people in the different departments getting all their pay, no cut. Let them call and say thanks to you. To the CMOs and others, you're all doing a very good job. Prime Minister, you're looking glowing. Thanks for everything. Get home safely, all.
Thank you very much.
Thank you so much. Thank you. Thank you for your kind words and your words of encouragement. We'll take another call. Welcome to Leadership Matters. Hello, good evening. You're live. Hello? Okay, we'll have to take another call. Welcome to Leadership Matters. Good evening. Okay, we'll move on. We might be having some difficulty with our phone lines. Welcome to Leadership Matters.
Hello, good evening.
Hi, good evening.
My name is Marshall Lewis from Sandy Point. I just called to commend the Prime Minister, Dr. Timothy Harris, for the tremendous job he's doing in keeping St. Kitts safe from this COVID. And I know that the Minister of Health and the other panelists is doing also trying their best to work with this COVID to keep us safe. And I want to congratulate all of them for the tremendous job they're doing. Prime Minister, you have on my favorite color shirt, pink. You're looking so smart, young, and intelligent. Keep up the good work, PM Harris. May God bless and keep you and have a good night and get home safe. Thank you, Jacqueline.
Thank you so much for your contribution to the program. Welcome to Leadership Matters. We'll take another call, sorry. Welcome to Leadership Matters. You're live.
Yeah, good night. I'll make my second question very brief.
Sure.
Hello?
I can hear you loud and clear.
I'm on? Hello?
Yes, Bucky, we are hearing you.
Yes. In terms of the fake news that is going around, is the government plan to do anything about it? Like today, there was a news going around about somebody died at the hospital from COVID-19, and it was totally fake. And my phone keep blowing up. There was one going on again that said that my loving Prime Minister is tested positive for COVID and he's in Koi Hotel hiding. And I see my Prime Minister up and down looking healthy. So the fake news is damaging the work, PM, that you and the government is doing. How do you plan to deal with these situations? Very quickly, in terms of the private nursery, when can they be reopened as they're not government workers, so this is their main source of income? So what kind of relief, how soon can they do some reopening? Thank you.
Thank you so much. And I want to apologize to all of our listeners and viewers for the difficulties we're having with our phone lines. I want to thank you for your patience, and I would encourage anyone trying to get in and having difficulties to continue trying. At this stage, we'll continue taking calls. Welcome to Leadership Matters.
Good night, Ms. Brian.
Hi, good evening.
And good night to the Honorable Prime Minister and his team. We want to commend you all for your hard work you all are doing for the people of this Federation of St. Kitts Nevis. Now, Mr. Prime Minister, I hear Bucky just say something in the first call about the severance pay. But I am a man always wrong tongue, and people always complain to me about calling in about the severance pay. And if 100 people they meet me in tongue and meet me in different places and tell me the politics, I get me money now, I get me money now, I got a drink for you. Up to the other afternoon, a lady going walking in the mountain looking for me animals them. And they say, politics, I get it thing, I get it, I get, So, Mr. Prime Minister, you is a man to your words. You said that the money is there, and really that the money is there for you. But you said that it take a time because whatever, with the procedure they got to go through, and people getting the money. It's a hotel that where I think that would the people that got difficulty with. All the workers, them tell me that they get the money because I was to work by the same hotel. So, Mr. Prime Minister and your team, I want to commend you and your wonderful work you're doing, especially under this situation of this COVID-19. I mean, Lord, the Honorable Akila Bayo Nisbet, you at the task of him with this COVID, and I know you're a woman, and you're a strong woman, and continue to do what you got to do for the ordinary man and woman as it in the Federation as the Minister of Health. You're doing a wonderful job. May the Lord bless this Federation of St. Kitts and Nevis, and let me continue to pray, because we got community spread now. Do not study the propaganda and the negative going on out there. You got people like me will challenge them. You understand? Because my back brother, they could go with any one of them. Because we say unity, and by right, Mr. Prime Minister, you and the cabinet is doing a wonderful job, and we got to commend you. We got to commend you all. You all have a wonderful night. May God bless all you and keep all you. And look over the Federation of St. Kitts Nevis. Ms. Brian, you're doing a wonderful job. God bless.
Thank you so much. Take care. We'll take another call at this time. We'll take a few more calls and we'll try and address the questions that we have here before us. Welcome to Leadership Matters. You're live.
Good night.
Good evening.
Yes, I have a concern. I was I have a son in the house here, go to Sunny Point School. You know, they were doing some testing with the children, so the parents had to stay home for 14 days. So I stayed home for the 14 days, and today I think it was 16 days. Now I'm home, and now I went back out to work after the 14 days. They're telling me that I have to get a letter so I could come back to work. So I want to know where am I going to get that letter from to go back to work. I'm home for these other days. Nobody say nothing about the money. Nobody say nothing about the job. I went back to work. I was told that I can't come back to work unless I get a letter from the task force or something like that. So I want to know where I'm going to get this letter from so I can go back to work.
Okay, thank you so much for putting that concern to the panel. We've made a note of it, and someone will address it. Welcome to Leadership Matters. You're live.
Good night.
Hi, good evening.
Good night to everyone. Good night, Prime Minister. How are you tonight?
Thank you very much.
I'm just calling to say, Prime Minister, I want to thank you for the wonderful work you're doing in St. Kitts Nevis. In spite of all the negative words and the world going through this crisis, St. Kitts and Nevis doing wonderful. Life in St. Kitts nice. Nobody at all complaining about the salary that they ain't get paid. Dr. Laws and Dr. I don't remember the other doctor name, man. I don't know why I get in this thing do. People ain't listening to the right set of people, listening to the wrong set of people and misleading them. Okay, so I want you to keep up the work, wonderful work. And Prime Minister, you stick to your word. Your word ain't run away left you. From the time you were on the campaign trail, what you say you're going to do, you did it. You're a man to your word, and you look good in church, and I'm allowed to see you on the pulpit. Church take you. Keep on serving God. And remember, Jesus loves you, and I do too. Dr. Laws, the next doctor, I have a question. If you allergic to aspirin, your blood type, this vaccine have anything to do with your blood type? My blood type is B negative, very rare blood, hard type of blood. So I want to know if the vaccine will do any harm to me, and I'm allergic to aspirin. So that is my question for tonight. Prime Minister, you're looking so wonderful. The devil in hell has a friend, and they don't want you to have no friend. Loving, caring, sharing, and always really willing to help. Thank you, Prime Minister. God bless you. Have a safe journey home, and everybody be safe. Akila, you're looking so nice over there. Akila, good night. Be safe, everyone. Bye.
All right, take care. Thank you so much for your contribution to the program. We'll take another call. Welcome to Leadership Matters. Okay, we lost that call, unfortunately. Welcome to Leadership Matters. You're live. Hello? Okay, I think at this stage we can pause just to respond to the question that we do have, and we can make another attempt to take additional calls afterwards. We have a question asking for an update on severance payments, Mr. Prime Minister. I don't know if you want to begin with that and get it out of the way.
Yes, thank you. I want to thank the caller. As we said, the federal government has never shirked from its responsibility to the workers. And the workers will always find a friend in my government and in the Prime Minister. One of the challenges that we faced when we took office was that the Severance Fund had long been hemorrhaging. That is, it was in deficit, it was in red, it was in overdraft, any of those will do. It had no money to meet the commitments. Part of the problem was that the last administration, in the run-up to the elections of 2015, in an effort to win votes, determined to extend what is being described as long service benefits to persons from two particular sectors. I think with the manufacturing and the hotel, if I'm not mistaken. However, in making that provision, it did not ensure that it found a source of funding for that particular program. So here was the Severance Fund already in trouble. And adding to its woes was the decision that now the fund had to make two distinct payments, severance payment, long service payments, and there were no adequate provision for either. As a result of it, this fund every year needed additional source of resources coming from the government. Imagine the calamity of having the highest number of persons being severed in the history of this country, and the fund then having to deal with that particular dilemma. The burden of meeting severance payment has rests with the federal government, and the federal government alone makes payments to those persons severed in Nevis and severed on the island of St. Kitts. To date, the government has paid out benefits to over 2,100 claims have been paid to date, and the federal government has had to find $34.3 million to make these payments. $34.3 million. Over 22 million of that amount was paid to persons resident or working in entities and St. Kitts, and over 11 million to workers resident on the island of Nevis or working in entities on the island of Nevis. We have perhaps another 642 claims, I am advised, which were being processed. I am advised that today those additional 642 claims had been fully processed and will be going through the appropriate system for payment. Every week, persons are being paid, and the government wants to ensure that everyone who is owed money receive their due. So it continues to move. Last time I think I was here, we reported 33 million. We are now up $34.3 million paid out. Over 2,100 persons would have received their monies. I'm advised by the Labor Commissioner that almost all the claims, perhaps except for about 69 or so, have been processed from last year. There are no claims basically outstanding, save for a small number for which there is missing data from employers or the work period is being contested between an employee and an employer. There have been cases where workers had their special arrangement with employers in terms of payment. There were some employees who knew that the kind of arrangement in which they were participating was not allowing for the payment of Social Security. And they participated in those arrangements until in the end, Now they have been severed. They go to the Social Security. There is no record in relation to that portion of the work. And those difficulties, of course, are being addressed. So we have satisfactorily dealt with over 2,100 already paid, 642 or thereabout clarified or finalized today, for a total of about 2,700 claims now being available for payment, of which 2,100 again have already been paid. So that's where we are with the severance arrangement, and we are happy that workers are feeling satisfied that at long last they are receiving their monies. We regret that there had to be delays, but the delays were not of our making. Where there were difficulties in the administrative response, we have corrected them. We added additional workforce to the Labor Department. We added other resources to ensure that it could get on with the task. Indeed, just this very afternoon, because this matter is dear to my heart, the Financial Secretary, the Cabinet Secretary, and I, in the presence of the Permanent Secretary in the Ministry of Sustainable Development, engaged the Labour Commissioner regarding what was happening and what more can be done to assist us. So every support of the government is being made available to this particular process. We are not like some countries who do not have the money at this time. Of course, we do not have a bottomless pit, but we prepared for this. And we prepared since last year. Recall in the announcement of the stimulus, we did say that about $40 million was being reserved for this. So we are not caught unaware in relation to the management of the severance needs of the employees.
Thank you so much for that. We have a question asking, what are the benefits of reaching herd immunity?
Okay. Well, the herd immunity threshold, and reaching the herd immunity threshold, is designed to protect those who cannot be vaccinated. And it's important for one to know that herd immunity is not an on and off switch, is not a panacea. So we don't reach herd immunity and drop our guard and become complacent, because we still will have to continue the prescription of non-pharmaceuticals until the virus is completely eliminated. However, by reaching herd immunity and by you being fully vaccinated, you know that you'll be protected from severe disease, from death from the virus, and you should be able to start gathering almost with a sense of normalcy, knowing that there is a decreased risk of the virus penetrating the group that you are in. And so hopefully when we reach herd immunity, we'll be able to see persons going back to sporting events in crowd with some degree of social distancing. We should be able to see mass events again. We should be able to see some degree of carnival. We should be able to see the churches returning to some sense of normalcy. So there are lots of benefits to be had from herd immunity, but don't forget, it's not that we reach 70% and then we drop everything else, because we need to continue to do what is right to keep the virus out so that we don't have a resurgence.
Can I add? Okay, so at present, if you are fully vaccinated and, for example, your workplace is implicated through the contact tracing process, you will be tested, and once your RT-PCR test returns negative, you'll be able to continue working. So that's an immediate benefit if you are fully vaccinated. That's important to note.
Indeed. Thank you so much for adding that. We have several questions that were put to the Minister of Health, and many of them regarding the hospital and nurses, saying that nurses are asking about overtime. They also asked how many ventilators are at the JNF, how many were there before 2020 and how many are there now, and if there are ventilators for children.
All right, thank you very much, Jackie. In terms of the overtime for the nurses. As far as I am aware, the nurses are paid their overtime, or if they work additional sessions, they are compensated for those additional sessions as well. If it is that there is a particular nurse who may realize that or believe that they have been paid short of what they they expected to be paid, the best thing for them to do is to bring it to the attention of the matron, who would then forward that to the ministry so that we can look into the details of it. But we do make sure, we make every effort to make sure that our nurses are compensated for the extra time that they do work or any additional sessions that they may work as well. In terms of the ventilators, we currently have 35 ventilators at JNF, and yes, we do indeed have about 7 of those ventilators that can be used for children as well. So yes, so that's the number of ventilators that we have, and about 7 of those ventilators can be used for children.
The additional questions asked by that caller were pertaining to the hospital itself. He asked what happened to outpatients, why is it split in 2? He also asked, do you think it is wise to have COVID patients on the same ward as other patients? And if it was wise for nurses who are working with COVID-19 confirmed patients to also be dealing with other patients?
Okay, I would allow the medical chief of staff to give an explanation on the, well, they said outpatient, but I know they meant A&E, which have a separation between A&E and the respiratory unit. So I'll allow the medical chief of staff.
Okay, so at the start of the pandemic, we made several infrastructural changes at the hospital to make sure that we can separate patients who have flu-like illnesses from the regular patient. We knew very early on that COVID-19, it was highly infectious, it was deadly, and we had no cure at the time. And so what we did, we created a physical barrier down the middle of the emergency room, splitting it into 2 and duplicating every single service on either side. What was good about the split that we made, though, is that there is a large double sliding door in the middle, such that if we get out of this pandemic, we can easily push the door back and have one unit again. But it was important for us to be able to have these patients separated from the regular service, because while we were in the middle of a pandemic, and we still are, and fighting COVID, we still need to continue to take care of the diabetics and the hypertensives and persons who present to the emergency room with emergencies. And so that is the reason why we have that separation. We also thought it was important for us to house persons who were diagnosed with COVID-19 in a separate space, and so we commanded the private ward for that so that they can be totally isolated there. Now, just because someone asks a question doesn't mean that what they're asking in the question is true. And so the caller spoke about nurses working on the ward where we house persons who supposedly have COVID and then going to the regular ward. That is not so at all. The nurses who are assigned to the COVID ward, that is where they work, and they are properly protected in the PPEs, and they do the donning and doffing at the beginning and the end of shifts. And it is known, the science has shown, that you can work properly protected among these patients and be able to go home without contracting disease and transmitting it to others.
I want to add that on the private ward, we only have COVID persons confirmed with COVID on the private ward as we speak. And so we do not have persons who do not have COVID on the same ward. So it's important to note that.
Let me just clarify that, just before somebody challenges you in that, or somebody suspected of having.
Right, yeah,
yes.
Right. And it's also the other question about the nurses who provide care to COVID patients and providing care to others. Once they are properly attired in PPE, that's also possible. And I want to add, if the nurses are fully vaccinated, it's important to note that there is no need for regular or frequent testing as suggested. And so that's why we use every opportunity to have all the even the nurses come on board in terms of accepting the vaccine.
And I think that's why it's important that persons call in with any concerns they have, so that it allows the persons who are working in these key areas to clarify any misconceptions that there might be. And that might tie into one of the questions we got about how the government tackles fake news. We have a caller who's... Oh, Dr. Wilkinson, before we move on, did you speak to why a fully vaccinated person still would not be allowed to attend a sporting event? We had gotten that call about herd immunity, and I didn't know if you included it in your answer.
No, well, we are in the middle of a crisis, and we put some emergency measures in place for the next 2 weeks. But as soon as we get out of this crisis, fully vaccinated persons should be able to attend sporting events.
Thank you so much for that. We have someone who said that they think you're too lenient, Mr. Prime Minister. I don't know if you wanted to respond to that.
Well, there always is a mixed view. Some at times say that I am too forceful, that I am demanding that people be vaccinated. And here we have a caller saying that I'm lenient. I am a leader who carries the pain of my people heavy on my heart and on my mind. I am a leader who want to share in their joys and in their sorrow. And part of my responsibility always is to help our people to get where they must go, where is necessary, where they can be safe and secure. Indeed, the theme of our last campaign was that we will have a stronger and safer future. And so I tend to encourage, urge, strongly require that we bring all on board to ensure that each one can enjoy this stronger and safer future. I believe the proof is in the pudding. And we have seen already that the vast majority of the adults in St. Kitts and Nevis have done the right thing. So I feel very much vindicated. There are times when we are going to have to, as it were, use the carrot policy, and there are times when we are going to have to use perhaps some other approach. I believe where we are at a good place. We are at the best place of all countries and independent states within the OECS and within the Caribbean region. And so we continue to urge, we continue to say, yes, we accept that you have a choice. But the lived reality of St. Kitts and Nevis, of the world, is that it cannot be a selfish choice. You must do the right thing, I must do the right thing, all of us must do the right thing in this war. Truth be told, there is no way that we can be neutral. We either want to win the war or we want to sabotage the victory. And I am satisfied that the majority of persons understand what is at stake. When young children would have to undergo quarantine, a new experience to themselves, because some adults did not do the right thing, we know that we have to do much better. When we understand that persons' livelihoods, hear the father tonight speaking to the fact that he had to be quarantined as a result of some contact with perhaps his child coming out of the primary school. Look at his agony now. Look at his agony. And that agony has come and will continue to come if persons only think about themselves. Who will think about the granny at home? Who will think about her? If she can't be vaccinated, then it requires that someone stand up for her. Someone go forward so that we could reach that target that will allow all of us to feel safe and secure. The concept then of herd immunity requires that all of us be vested with a desire, be keenly aware that it takes an entire country, an entire community to defend the community and to defend the nation state. So, in a nutshell, then, I feel vindicated at our approach and all the right things that we have been doing and all we have ever said and all we have ever done and will continue to do has been guided by facts, by science, and we have been very persuasive where we need to be in attempting to let people know, because really, from the very beginning, you see the consistency. Follow the non-pharmaceutical measures until we get a safe and reliable vaccine. We now have one. We have to thank God that He has, by His own intervention, allowed us in St. Kitts and Nevis to be able to have a vaccine and to have one that is reliable, to have one that has been used by over 148 countries around the world, to be in a position that we have vaccines and some countries do not have. All these did not happen by chance. It came from capable management, advanced planning, and a strategy that has clearly worked. So I feel comfortable with myself. I feel comfortable with every movement that we have made so far. I feel comfortable that the science has not let us down, and I believe it will never let us down. So I feel confident that the advice and the prescription that we are doing, and yes, I would want people to go of their own volition. But I've always said that in a war, no tool is ever off the table. It's the same approach again, by way of analogy, I have taken with respect to the fight against crime in the country. No tool is off the table. And always we must have all the tools that are required to take us to that safe harbor which we need to be. And we encourage everyone again to join us. Our sense of perhaps some may call leniency. And leniency is a good quality to have. Because I recall going to Sunday school and the talks about the twin siblings. It was always about grace and mercy. And with mercy comes leniencies and acceptance that people perhaps may have walked a certain path and deserving of what may come to them. But that you say, no, I will intervene to offer them some better choice. That is the role of the leader, and that is the quality of leadership that we have.
Certainly.
Okay. I would like to inform the public that persons who received their first dose of the COVID-19 vaccine during the month of March, and you have not yet come in for your second dose, it means that it's overdue, it's past due, and we are encouraging you to come in to any of the health centers this week between the hours of 1 to 4 to get your second dose. And then I would go on to suggest and encourage individuals who received their first dose in April, between the 1st of April and the 23rd of April. We are encouraging you to come in early to get your second dose. And so, despite the appointment on your card, you can come in this week, again, between the hours of 1 to 4 p.m. in St. Kitts and 9 to 4 in Nevis to get your second dose earlier than the date as indicated by the appointment on your card. So let me repeat, persons who received their first dose between April 1st to 23rd, we are encouraging you to come in earlier than your appointment to get your second dose.
And Jackie, I just want to address something someone raised about the fake news and the death. Because this morning, as I do most mornings, I called the specialists working on the private ward to find out how the patients were doing, and I found that all 4 were stable and doing fine. I updated the CMO, and I was shocked and surprised when I saw circulating on social media this news that one of the patients died with a picture. And I think it is very tough on persons when they're in the hospital fighting a deadly disease like this and turning the corner and doing well, for persons to be spreading fake news with a picture saying that the person is dead. You could imagine how tough that was on the patient, on the patient's family, etc. I even got calls or WhatsApp from persons in the UK and North America asking if we had our first death. And for someone to be doing that, it must be a malicious attempt at what we are doing. And I want to ask persons, we can have disagreements, but we don't need to be enemies, and we don't need to misconstrue the information. And so, especially when somebody is in the hospital and fighting to get better, let's try and keep them out of this and stick to the facts.
On that note, I think, Mr. Prime Minister, I can put the question to you that the caller asked if the government is planning on doing anything regarding the matter of fake news.
Well, I think in large measure, that is why we are here tonight, in part, to be able to bring the facts and to have the authorities and those most knowledgeable to inform the people. So part of our response to the fake news is to keep the public abreast of what is happening in the country, to be transparent about it, and to explain as much to the people so they understand. There will always be, unfortunately, as we see it play out, some who, for selfish motives and for their own political agenda, would want to have bad news in the country. Some have not learned. Some have resorted to politicizing the efforts even of professional people in doing such a marvelous job of protecting our country. We just went through an election 1 year ago. We had those challenges of fake news. We had put on the ballot paper whether the government, my government, had done a successful job in keeping the people safe and managing. We had an overwhelming response where in 9 out of 11 constituencies, the voters indicated a strong preference for the Harris-led administration. That is the reality. Some people are again engaging in the same old politics of obstructionism, that even when they're good, they want to do a dance, an old-time dance, taking us back to what we had forgotten. The country needs a new direction of solid guidance on those issues which are national in nature. And this COVID-19 doesn't respect colors, politics, age, or any socioeconomic indicators. We're all in this together. And those who are opposed to the government could play a constructive role, but finding a wise place in which they enlighten, they educate, and they support that which is in the national interest. And so, in the end, the public again will have an opportunity to determine. I believe that the public is satisfied. And again, the evidence of it we can deduce from the fact that 64% of all adults resident in the Federation have done the right thing. The majority of people are with us. And I take comfort in that.
I want to just let persons know at this stage, because of the high volume of messages that we are receiving, it's a little slow to go through and get confirmed, but you don't need to send it twice. It will eventually come through. Again, we have a high volume of calls and messages, and we're trying our best to take as many as possible. We're going to go back to the phone lines at this stage, take some additional calls, see how many we can get in the time frame that we have allotted to us, and address as many of your concerns and questions as possible. So we'll take another call. Welcome to Leadership Matters. You're live. Hello, good evening. Okay, we'll take another call. Welcome to Leadership Matters. You're live. Okay. The numbers are just...
Hello?
Oh, hi. Good evening.
Hello, good night.
Hi, we can hear you. You're live.
Yes.
Okay, just to let you know, the numbers are 466. We seem to be having some difficulty with that call. The numbers are 466-2666, 662-8674, 767-4765, and the international line is 661-5683. I'll ask the producers to let me know when we have a call. We might have to take them as we go along this evening to try and accommodate you. And we will try our best to accommodate you. Do we have a call at this time? Welcome to Leadership Matters. You're live.
Hello, good night.
Hi, good evening.
This question is for Dr. Cameron Wilkerson. He said during his presentation that some of the persons who have recently received their first dose was tested positive. Is it possible that this first dose and being tested immediately or soon after would have implicated the test results?
And Dr. Wilkerson? Okay. Thank you so much for your question. We'll take another call. Welcome to Leadership Matters.
Good idea.
Hi.
Yes, you hearing me?
Yes, you're live and you're loud and clear.
I have done so with anybody address my question in relation to where do I get a letter from so I could take back to my workplace so I could start working again.
Okay,
that's all they're asking for. They're asking for a letter to show that I am clear from quarantine so I could return and start working again. Thank you.
Thank you so much, and thank you for the reminder, sir. As per usual, I've made a note of all the questions that we've gotten via our phone call. You have not been forgotten, but I'm trying to take the questions as we go along because you might realize we're having some difficulty with our phone lines, but I have it right here. As a matter of fact, can we address that now? He's very concerned.
Yes, we can probably take his name, or we can ask him to call 311 to provide some basic demographic information so that the Minister of Health can complete his letter so that he can take it to his workplace.
Okay, well, thank you so much for that, and I hope he's listening. The number to dial is 311 so that they can sort you out with that letter. But we've not forgotten you. Thank you. I realize I can hear in your voice it's a very important matter, sir. We'll take another call at this time. Welcome to Leadership Matters. Okay, unfortunately we lost the call. Welcome to Leadership Matters.
Yeah, good evening. How are you doing?
I'm fine, thank you. And yourself?
Mr. Pastor and the I want to say special good evening to you all. I believe the along with the Prime Minister is doing a wonderful job. And I pray God blessing and God's speed and guidance upon you all. What if we didn't get the vaccine in St. Kitts and every other island get it? We would have been making noise. How come we can't get it and they love us so much? Now it's here.
Okay, unfortunately, we've lost that call. And I want to thank the callers again for your patience. We'll take another call. Welcome to Leadership Matters.
Hello.
Hello.
Hey.
Good evening. You're live and loud and clear. We can hear you.
Okay. Yes. My question is, we have here an outbreak in St. Kitts, and you guys are saying, well, the government are saying they encourage people to take the vaccine. How do you go about, in terms of whether or not you have the COVID vaccine, you have the COVID or not before you take the vaccine? You guys are testing people at this point in time when they go to take the vaccine? Rather than to just give them the vaccine one time or just go ahead and recommend the vaccine because there's an outbreak. And the next question is that, why is it are we using that particular, which is the AstraZeneca vaccine, when it was stopped in the US and the UK because due to testing they were killing the animals? And my next question to the vaccine is that it was used for emergency purpose. So what will be the long-term effect for people who take the vaccine now?
Okay.
Those are my questions.
Okay. Our medical professionals would like to address a statement you made, which concerns them, and they'd like to clarify that now.
Yes, well, as the Prime Minister said in his presentation, the Oxford AstraZeneca vaccine is safe and effective and is being used in more than 148 countries around the world. As a matter of fact, it is the most widely used vaccine globally, and it's been proven to be safe and effective. And so what the caller said is completely erroneous. Now, there was also somebody who asked about whether or not some of those persons who tested positive, if it was related to the vaccine. That is not so. The test for viral particles in the nostrils. The vaccine generates antibodies against the virus, and so there is no interaction at all. Getting vaccinated does not give you a false positive PCR test.
And can you speak to the long-term effects? The person asked?
Well, we know that the vaccines are safe and effective. They were in tests for quite some time. Just because the vaccines came on board about a year ago, the principle involved in the vaccine has been in existence for more than 10 years with the SARS epidemic, etc. And so we know these type of viral transport vaccines do not have any side effects, and so the scientific evidence doesn't point to any long-term effects. We know, though, that by getting the vaccine now, it can protect you from getting severely ill from COVID-19 and from dying from COVID-19, and that's why we advise you to take it.
And there is no need to test an individual prior to administration of the vaccine. Okay. That was alluded to before.
Yes, that question was asked. We had a caller
One final point though on the matter of the vaccine, because this keeps coming up as people attempt to confuse people. I want to make reference to a statement made by the Dr. Etienne at PAHO. The best vaccine is the one that is available now. The caller is right. We have an upsurge in the infections. And we have a vaccine that is used by the majority of countries around the world, big and large, and people are asking for what is not yet available. The best vaccine is the one that you have. And we have one that has been tested and is widely used. And when we made the judgment call, we were advised that it was best suited for our region. One of the things some persons in the opposition has shown up, again to confuse and to play the game of obstructionism, is basically, well, tell them to give you the Cuban vaccine. I want to make the point that there is no Cuban vaccine, I repeat, no Cuban vaccine that has had the approval of the World Health Organization for use. There is none. So you should ask yourself, why should a doctor who knows better encourage persons to look for something that in reality is not available to them? Because we have established as a policy for the protection of people in St. Kitts and Nevis that any vaccine we use here must have the approval of the World Health Organization, which is the premier body dealing with public health. And I wondered why people continue with these mischievous ways to halt the progress. And when persons fall sick, they will not be there to comfort them or to help them. They are giving bad advice. And while some of those in opposition are giving bad advice, they are sneaking to get the vaccine and not making it public. I want to read today the letter that I had, dated the 8th of June, from the Embassy of the Republic of Cuba. The Embassy of Cuba in the Federation of St. Christopher Nevis presents its compliments to the Honorable Ministry of Foreign Affairs and Aviation and has the honor to advise the following regarding the request for information about the development of Cuban COVID-19 vaccines by the Honorable Prime Minister, Timothy Harris. Cuba has 5 COVID-19 vaccine candidates that are what they are, candidates, still awaiting approval. This is what the ambassador is saying. Still awaiting approval. They are as follows. Mambisa, still awaiting approval. No approval for its use. Abdallah, still awaiting approval. Soberana 1, still awaiting approval. Soberana 2, still awaiting approval. Soberana Plus, still awaiting approval. But how could any doctor, how could any patriotic citizen be out there telling people to hold on and wait for what doesn't exist, what is not yet approved? It is unconscionable. And we, the citizens who love our country, must call them to account for this mischief and reject them as people from whom independent and professional advice could be had in this battle against COVID-19.
Thank you for clarifying that for us, Mr. Prime Minister. We have a question also about asking if you're allergic to aspirin, can you take the vaccine, and how does the vaccine affect your blood type? If anything is related between your blood type and the vaccine.
There is no relationship between your blood type and the vaccine. No, whatever your blood type is, you can have the vaccine. There is no cross-reactivity between allergy to aspirin and the vaccine. If you have an allergy to aspirin, you can take the vaccine.
Thank you so much for that. Do we have any additional calls at this time? Well, I think what we're going to do right now is take a quick break. We're overdue for a break. We're going to take a quick break, and when we return, we'll try and take as many calls as we can, and we will definitely go through the messages. So sit tight, and we'll be right back.
Tonight we had another successful town hall meeting in which we engaged the community regarding the vaccination rollout in St. Kitts and Nevis. As of this afternoon, we had just under 6,000 persons who have been vaccinated. That brings us close to 18% of our target population, which we need to have vaccinated to achieve herd immunity. Tonight's session was to bring the information to the people in a manner in which they have the opportunity to share their concerns, to express their fears, and to have them answered by the professional and the experts in the health ministry. I want to commend our Medical Chief of Staff, Dr. Cameron Wilkinson, our Permanent Secretary in Health, Dr. Dolores Stapleton Harris, and of course the District Medical Doctor, Dr. Bernice Nisbet, for participating in this very rich experience for the people of the community of St. Paul's and the adjoining areas. I think this has been highly successful. We had a sense of joy. We, at the end of the question and answer period, a number of persons moved forward to have their vaccination. That tells me that it was very persuasive, it was impactful, and it has helped. And I know these persons are going to be ambassadors. They're going to be out there with their own experience, sharing with others, and as a consequence, we're going to have more persons participating in the program.
The rebuilding of tourism starts with taking the vaccine.
I'm taking the vaccine for a healthy nation.
I for sure will be taking the vaccine.
I am taking the vaccine because it's the best way to get back into full swing. Stay safe.
I've taken the vaccine for my family, for my friends, for my community, and for me.
Welcome back to Leadership Matters, which is hosted by Prime Minister Dr. the Honorable Timothy Harris. He's joined this evening by the Minister of Health, the Honorable Akila Byron Nisbet, the Chief Medical Officer in the Ministry of Health, Dr. Hazel Laws, and the Medical Chief of Staff at the JNF General Hospital, Dr. Cameron Wilkinson. And we are discussing how to ensure safety during this COVID-19 pandemic. We'll go back to the phone lines. We're giving our callers priority this evening because we've had some difficulties with the phone lines. So we're going to go straight back to the phone lines to see how many we can get in so that we can wrap up hopefully sometime soon. We'll take our first call this evening after the break. Welcome to Leadership Matters. You're live.
Greetings to all. Greetings to all. Can I be heard?
Hi.
Okay. Okay, we have a concern and we have an observation that we. The first thing is the folks who take their first. We heard a sound that people who are supposed to get their second dose, the time is overdue. We have a concern with that because if it is a package where one have to take one shot and another shot and the time is overdue, we would like to implore those, who go through their first dose of the whatever, to just follow through, because that is the order, that is the way it's set, So hearing that sound, we have a concern because, that can cause a different effect within the whole scheme of things. The second thing is, Honorable PM, do know, that where a lot of information are being flowed, concerning what's the name of the vaccine that we have within our midst? What's the name of the vaccine?
Yeah.
What's the name of the vaccine? Please.
AstraZeneca. AstraZeneca.
Oh, okay. Please know that there's other sources of information flowing concerning this vaccine. So therefore now, when those information are out there and the information that you share concerning who we are getting our information from concerning the safety of the vaccine, there's other information out there circulating, and it don't really mean, although there can be conspiracies and there can be political whatever. Let us all be aware that a lot of information are out there flowing. So therefore, all we have to do, as it was mentioned earlier in some program somewhere, diplomacy have a lot to do with going forward with this whole thing, Diplomacy. We have to just know, we have experiences of past things, and we are dealing with something present. We are dealing with people. People have their flexes, and as I said before, a lot of information are flowing. Let us just use more diplomacy than anything else to achieve what we're trying to achieve. I'm glad to hear that we are getting near there. And once again, I'd like to implore, I said it's another program, people who have stated that they're at the back of the line, they must step up in the line, because you are in the line. And people who are taking the vaccine secretly, as it was.
Okay, I think we lost that call, unfortunately. I'm just going to ask callers to try and be as brief as possible because we're trying to take as many calls as possible. Given the situation, we know a lot of people have questions and concerns. We'll go back to the phone lines. Welcome to Leadership Matters. You're live.
Yes, good night.
Hi, good evening.
Very quickly. This question is to the CMO. Dr. Wilkins, this question is for you. Do you think we dropped the ball, the task force, where that to have the COVID patient at the James Hospital? Do you think that we really dropped the ball, wishing that we could have them? We are in a different area. For instance, in Molineux, there's a hospital. Do you think we can use that area, the hospital in Molineux, to have the COVID patients hosted at that area, instead to have them at our main hospital which that Jerry has. You know what I mean? He said to split it in half, where you have outpatient. I just said you have what we call a plexiglass, you know, sliding glass, just separating from the COVID patient to the non-COVID patient. Why we didn't put them in an area that they didn't have to mingle around those who really come to see the doctors at the outpatient? Because look at it. You can be at outpatient waiting and they come in with a COVID patient and everybody going to have to leave, because I am seeing it. I mean, you seeing down there around outpatients and they're bringing somebody have COVID and you have to leave the area until, you know, they sort out that problem. Why we didn't use even Malin Hospital? Those have COVID that can go in the area, right? So wishing that they will have to mingle. That's the question. Why we didn't utilize that area instead of coming our main? The other question I want to ask you, towards where you're saying that there's no doctors, no nurses, is working alongside the COVID patients and working not in other wards. Nurses are listening and are very disappointed in what you're saying tonight. Let's move on.
Move on regardless. I think that was already addressed, and we have to try and get to the people who have not been able to get in as yet. So we'll take another call at this time. I want to thank you for your contribution, and you've been very fortunate to get in twice when we have persons struggling to get in even once. So we'll take another call at this time. Welcome to Leadership Matters. You're live.
Hi, good evening.
Hi, good evening.
All right. My question is, the doctor, Dr. Wilkinson said there is over 100 and something countries that are using the AstraZeneca vaccine. Now, is it, well, any of those countries are developed countries? That's one. When it comes to the businesses that are temporarily closed in Bastia or whatever the address will be, if a company is fully vaccinated, but there is a COVID outbreak in that company still, because the vaccine doesn't prevent you from getting the COVID, do you temporarily close that business still, even though they are temporarily, they are fully vaccinated? And
okay, well, thank you so much for that. We'll take one more call before we break and hear from our panelists and try to wrap up this evening. Welcome to Leadership Matters. You're live. Hello? Okay, I think we lost that call, but we can definitely deal with the questions that we have remaining. We had a question from before that I overlooked. Unfortunately, this person was asking about private nurseries, seeing as they're not employed by the government and the nursery is their source of income. They were asking when can private nurseries reopen?
Okay, so for me, if I can start, that's a very good question. And I think the starting point is, are the staff members working at that private nursery fully vaccinated? Because that's a plus. And then are the parents of the children who would be attending the nursery fully vaccinated? Two very important points to consider in terms of the reopening of private nurseries. I don't know if Dr. Wilkins wants to add anything.
The caller asked about if the vaccine is only being used in third world countries. The vaccine, as we said, is used in more than 148 countries around the world. It's being used in Australia, in Brazil, in Britain, so it's used in many first world countries. It's the primary vaccine being used through the COVAX facility of the World Health Organization. And as it relates to us dropping the ball in terms of having the patients who are afflicted with COVID-19 on the ward, one of the things that I want to tell everyone is that the way you will protect yourself is by assuming every other person has COVID-19. That's why we ask you to wear your mask. That's why we ask you to stay 6 feet from everyone. And don't forget, that patient can be you tomorrow. And so you want to make sure that you are treated with the same humility and compassion. And the patients who have COVID-19 or who are suspected of COVID-19 can also have appendicitis, they can also have cardiac problems, they can also have asthma. So it's not that they are being treated on the private ward just for COVID-19 disease alone. They have other conditions that have to be managed. And so there is no reason for us to put them separate from persons in the main institution.
And so between last year and present, we've managed a number of COVID-19 positive patients at the JNF hospital without any outbreak or any issues. So it has been happening.
The final question I have from any of the callers would be about if employees of an establishment are all vaccinated and there still is a case or more at the establishment, would they have to close and quarantine in the same manner?
Okay, so as I said before, if you have a company and you have X number of your employees fully vaccinated and the company is implicated through the contact tracing process, those who are fully vaccinated, they would have to test to see, if they're positive or negative. But once the test comes back as negative, the fully vaccinated employees can continue working. So we've said that earlier in the program already.
Thank you for reiterating and clarifying for the listener. And before I allow you all to wrap up, just a quick number of updates for the persons who have sent messages. We're not going to be able to go through all of your messages this evening, but the first few I think are just for update purposes. We have someone asking about the vaccination cards, an update on vaccination cards for persons who have been fully vaccinated.
Yes, previously I said that the cards would be ready by June 9th, but then guess what? We had the outbreak and we had to shift our focus in terms of focusing on containing this outbreak, and so we are a little tardy in completing the signing of the cards, and so this will be completed shortly. I don't want to give a date again, but at the soonest.
Okay, thank you so much for that. And I think from what I've gathered, we might have to end there.
There is one question I want to address because it's been asked many times and it's becoming a part of fake news really, in that we are going to vaccinate right down to the end. So there was a question you had here that you sent to us asking if it is true that last week was the last time persons can come for their first dose. You can come for your first dose every day right down to the 30th of this month. Okay, so the vaccination rollout continues for the first and the second dose all the way down to the end of this month.
And for all the persons who sent messages, I deeply apologize. We're not going to be able to go through them. We are overwhelmed by messages. However, I have been informed that someone will try to address your concerns and respond to your questions via WhatsApp. So hopefully you will be able to get a follow-up via WhatsApp if your question was not answered live on the air. So thank you so much for your patience and for bearing with us and for understanding some of the challenges we faced this evening. I'll allow for our panelists to wrap up this evening.
Before we go there, just to add, because the caller who spoke about having been quarantined and needing to get a letter to the employer should say to him that under the current provisions of the Social Security, persons who are in quarantine should be able to claim and make a claim to Social Security and therefore secure some benefits. If there is any additional information required in relation to that, he should speak to the officers at the Social Security Board, or the Labor Commissioner would be able to provide additional information. So you can recover at least some of your earnings if you're an employed person and you meet certain requirements. Of course, those claims will be processed by the Social Security office. And the final matter in relation to pay, I should say, I think it was in May 2020, the Team Unity government made a substantial adjustment in the pay package of nurses in St. Kitts, costing several millions of dollars. We will therefore be the last to shortchange any nurse in relation to their labor, and indeed any worker in particular. Callers should be aware, and every nurse is aware, that there are appropriate channels within the system to address any difficulties they may have in relation to their payments. So I would encourage that they go through those channels to have them resolved, because there may be situations peculiar to particular individuals, and they have to be addressed a certain way.
I think it would be also helpful to share this message that we got, because questions about asking for updates about severance payments, I think, comes up almost every program. Yes. And we have someone who said, "Good night, Mr. Prime Minister. I must say I am from Nevis and I have received all of my severance benefits. Thanks to you, great job. I hope others get theirs soon." So thank you for sharing that with us, and that update on your situation, so that people can have some sort of assurance that the severance payments are continually rolling out, in addition to what the Prime Minister said. So we're going to begin with Dr. Wilkinson. Would you like to begin first?
I just want to say that in a pandemic, time wasted can result in a life loss. There are so many persons who have been calling me after they have been named as a significant contact. There are some persons who have called me regretting the fact that they tested positive and they had wasted the opportunity that they had to go and get vaccinated. I want to tell you to listen to your information from a reputable source. You can follow the information that we have given you. We have come to you for over a year now, giving you the facts, and the best way you can protect yourself is to go out and get vaccinated if you're over the age of 18 and can be vaccinated. So give yourself a fighting chance and give yourself the opportunity of a lifetime by going out and get vaccinated tomorrow. Thank you.
Thank you so much. Dr. Laws?
Tonight we want to reassure the public that the National COVID-19 Task Force, the Health Emergency Operating Committee, and the health team, we are working tirelessly in terms of containing this wave of COVID-19 cases. However, as individuals, I want to implore all of us that we have a role to play in this fight. And you and I can help by wearing a face mask once you're out in the public domain. We need to maintain good, adequate hand hygiene. We need to maintain that safe distance of keeping 6 feet between ourselves and others when we're in the public domain. Avoid crowds. And those of us who are not yet vaccinated, we want you to empower yourself and come on board and get vaccinated, because these are the measures that are going to help us to get through this second wave of cases. These are the measures that are going to help us to flatten the curve. Thank you.
Thank you so much. Honorable Akila Barron Nisbet.
Thank you, Jackie. Once again, I want to just thank the viewers and listeners who tuned in this evening. Thanks for all of your questions as well. But I just want to remind persons, the Ministry of Health have been strengthening the health system for over a year so that we'll be able to manage the pandemic at the rate at which we've been doing so. We have been strengthening the system through investment. We have been strengthening the system through policy changes and upgrades to the policies within the Ministry of Health. But we can't do it alone from the Ministry of Health. We need your help as well. And just as the CMO said, each of you play an individual role in making sure that we're able to maintain the strides that we've made thus far. That means we are asking you to continue to wear your face mask, continue to social distance, and please continue to make sure you wash your hands or sanitize your hands regularly. For those business places, we want to remind you to make sure all high-touch surfaces are cleaned regularly. Make sure you're keeping track of persons who come in and out of your establishment to help our contact tracers should we need it. Please make sure that you are checking your employees to make sure that they are healthy, there are no flu-like symptoms when they come to work, and please to make sure you continue to follow all of the protocols that were handed down to you when we reopened the economy over a year, just over last year in October. These are what will keep us, these are the measures that will keep us safe, and we need your help to do that. And so we're encouraging persons to continue to maintain those non-pharmaceutical measures. As for the vaccines, we're encouraging persons, please continue to go out and get vaccinated. And for those persons who have already taken the first dose, please remember to go back for your second dose. That second dose gives you that extra boost to your immune system. The vaccine is most effective after your second dose. So please remember to return for your second dose. Encourage everyone around you to also be vaccinated, because it's the best shot for us to be able to get back to some level of normalcy. The CMO would have indicated that we would be expecting persons who would have gotten their vaccines around April 1st to 23rd to return to the clinics before your actual due date in your card and start getting that second dose. And so we're looking forward to seeing persons returning for that second dose. And we will give more updates in terms of persons coming out ahead of their scheduled date in order to be vaccinated. Because it's important for us to turn that 63% that is already vaccinated with first dose into second dose vaccinations as well by the end of this month. And so again, I'm just asking everyone, continue to follow the protocols that have been established, and please turn out, get vaccinated, both your first dose, and remember to return for your second dose. Thank you very much for listening, and thank you for engaging with us.
Thank you so much, and now we'll hear from the Prime Minister.
I would want to again express my gratitude to the listeners and those who tune in to tonight's edition of Leadership Matters. I gather that we had tremendous response across all platforms, and we had one of the highest viewership in recent times in relation to this program. So I want to say thank you, and I hope that those who tune in find it informative, constructive, and helpful, and that those who also tune in will do everything in their power to encourage others to get vaccinated. It is the most powerful tool yet available to us in this fight. And it's for this reason in part that tonight we come and we are able to be cool, calm, collective, and organized in terms of a response, because we have a critical tool to fight this battle. This is one of the contrasts between last year, when we instituted lockdowns, and several of them, to where we are now. Back then there was no vaccine for our protection. Today we have. And today we have a significant portion, the vast majority of thinking people, the vast majority of responsible persons have moved forward to be vaccinated. Indeed, over 30,000 doses of vaccines have been administered to date. And of that percentage, 64.3% have received their first shot. And that is critical. That puts us in a stronger position now to fight the battle without going to the nuclear option that we heard Dr. Wilkerson reference earlier. In other words, we have a number of tools, we have a number of things in our arsenal to fight, and we are being judicious in the use of them. Bearing in mind always that we have the challenge of balancing lives and livelihoods. We are clear, if we ever were to make a judgment, we will advance the precautionary health principle, and we will make the judgment to save lives. That will come easy. I want to make the point that even in the midst of this storm, this war, we have been able to be as calm, as professional about it. Not meaning to underestimate the difficulties, but to say we have confidence in the excellent work we have done in the past. We have confidence in the reliability of the information provided by our health personnel so far, and we shall continue to work our strategy. We are encouraging all our residents and citizens to do the right thing, to become vaccinated. There's a light at the end of the tunnel, and that light will come shining through once more of us tomorrow, the day after, and the next become vaccinated. So I thank the country again for the opportunity to serve, and I look forward to your continuing cooperation in this national fight, and in fact it is a global fight to defeat COVID-19.
Thank you so much, Mr. Prime Minister. I too would like to thank our callers and viewers and listeners for tuning in, for making Leadership Matters your choice, for sourcing information that's very up to date and informative. I hope you found the program informative. Our panelists, I want to thank them as well. I know they've been having days and nights that might seem longer than average, and yet they've made themselves available to be here this evening. We were able to answer all the calls that we got, despite the challenges. We had a number of things that were put to them. They responded, and I hope that the responses were beneficial to even the persons who sent WhatsApp messages. I know some of the WhatsApp we got were answered because of the callers who called in. So everybody was able to play a role in some way during this show. My name is Jacqueline Bryan. I was your host. Thank you so much. Take care.